Sneak peek 2025 Medicare RX. What is this drug card going to look like? How much is it going to cost me? What is the premium? Hi, this is Kathy Bukowski. I'm the owner of CB Health Insurance, and this is the CB Health Insurance YouTube channel. In today's video, we're going to cover that. We're going to answer those questions to the best of our ability, and we will cover as much as we can of what we know is changing. I want to welcome those people that are new to the channel watching for the first time and remind you to subscribe, hit the little bell so you get future notifications when we release new videos, which is about twice a month. Tell your family and friends and give us a thumbs up. Now, on to today's video. We were told a bunch of things about 2025 drug coverage, right? First and foremost, the max out of pocket is $2,000. The donut hole is going away, but everything else, we don't know what it looks like. Well, NABIB, the National Association of Benefits and Insurance Professionals, that's a mouthful, is an organization, nationwide organization that I'm a member of, and it's made up of health insurance agents that sell in different markets, from individual Obamacare ACA to employee benefits for businesses, employers, large and small, and Medicare. Okay. And they released an infographic showing you what it's going to look like. So we're going to go over that. The second thing I'm going to cover, the second part of the video, is I'm going to talk about the CMS releasing the premium as it relates to 2025. So there's some information about the base premium and the bid amount and what the heck does this mean and what can we expect. And I know some of this, I'm going to try to decipher it to the best of my ability, but bear with me here. Let's start off by looking at this infographic that's provided by CMS. So let me go pull this up and let's take a look. Oops. How about if there we go. Okay, so the infographic is showing you what the benefits are for Medicare Part D, which is drug coverage provided by private insurance companies for 2025. And we see 4 levels. We have the deductible, the initial coverage, the catastrophic, and the plan year ends and starts over. So the way this works is the first level is the deductible, and this is going up. For 2024, I think this is what was it? I don't remember. $545. Okay. It's going up to $590 next year. And when I first read this, it said you are responsible for 100% of all prescriptions until you meet the deductible. And I went, whoa, that's not how the drug cards work right now. But if you read further, it says some plans carry a 0 deductible. And in some cases, the deductible may be waived on lower cost drugs. So tier 1, tier 2. Oh, by the way, that's how it works today, right? The one thing this doesn't tell you is if there are co-payments. If the deductible is waived, what is my co-payment or what is my co-insurance? Am I going to pay 0? Am I going to pay $2 for a tier 2, $10 for a tier 3? I don't know. My guess is that we're still going to have co-payments at the first level. Okay. Now, once you hit that level, $590 is the deductible. And I don't know if that's all the co-pays as well. Let's say you're all only on tier 1 and tier 2. You may never get to the next level because your co-pays don't add up to $590. I'm not sure how that accumulates, but let's say you hit $590 and you go to the next level. This is the initial coverage where you will be paying 25% of the cost of the drug until you hit $2,000 out-of-pocket max. Right. Now, what it doesn't tell you is the $2,000 is a true out-of-pocket max, meaning this is the most you will ever pay. So this number includes this deductible, which is good news, right? And so it is not $590 plus $2,000, it's $2,000, and then you're done. Once you hit that, you go to the catastrophic level. It costs you 0. 100% of the cost of the drug is paid for by the plan until the end of the year. In January 1, you start over. So all the drug cards go January 1st through December 31st, and regardless of when you start. So if you're new to Medicare, signing up for the first time, and you enroll, your birthday's in October, and you enroll October 1st, you will have that drug card through the end of December, and then January 1, you start over. So they all work this way. Page 2, and here's my information. I will go ahead and provide this on the in the description. Page 2 goes over some other things about the drug coverage, the tier levels, the plan rules, and the costs. And this is just generic terms, right? So we know that there are 5 tiers on every drug card. And so CMS kind of gives guidelines to the private insurance companies that provide these drug cards. They have to have all these levels, right? And they have to have these rules and whatnot. They have to provide a drug in every category, but they can be all these different. They can be a tier 1 drug, which is preferred generic. So this is a low cost generic drug. It can be a generic, which is going to be a slightly higher cost than a preferred. It's going to be a more expensive generic. It could be a tier 3, which is preferred brand. Tier 4 is brand, and tier 5 is specialty drug. Now, currently, there's a handful of drugs that have a tier 6, and I haven't seen it illustrated in a brochure, but I don't think all drug cards have tier 6, and I'm not sure if that's going away. I don't know. I know that they all have to have these 5 tiers. With regards to the rules, I like this name here, rules. Some people would call this restrictions, but there's 3 things: prior authorization, step therapy, quantity, 4 things: quantity limits and coverage exceptions. Prior authorization says that your physician is going to have to get advanced approval before you can take a specific drug. Okay. Step therapy is going to require an authorization. You're going to have to start with a less expensive drug before you can get to the more expensive drug. So they want you to kind of step up. So if there's a drug that covers high blood pressure from tier 1 to tier 5, they're not going to start you off with the tier 5 drug if it's step therapy. They're going to say you need to try the lower cost ones first and see if they work for you. Quantity limits, they're going to limit how much you can get. Typically, it's a 1 month supply. I know there are some drugs, some people that do mail order and they get 3 month, 90-day supply. And some people fill 90 days at the pharmacy, but this is going to limit it. And these are going to be drugs that might be addictive in nature, very high cost, and or need to be monitored by the doctor on a regular basis. Last but not least, coverage exceptions. CMS allows the carriers, the insurance carriers that are providing Part D drug coverage, to request it and obtain an exception when a drug that they don't cover on their formulary list and you want to see if it's covered. So most of them have a process where you can see if you can take this drug that is currently not on their formulary list. The other exception would be to request a waiver on one of the limits, either quantity limits or step therapy or prior authorization. So that's another exception. The last column talks about the cost. Of course, there's a premium attached to this, right? But you also are responsible for paying the deductible, co-payments, and co-insurance. Now, the one exception is if you're Medicare, Medicaid, if you're dual eligible, which is Medicare and Medicaid. Medicaid will pay, I think, all of the premiums. You owe nothing, and most, if not all, of the deductible and copays. You're going to have little or no out-of-pocket costs. There's also another level called extra help. I don't know that you have to be Medicaid eligible, but the government has extra help. If you qualify for this, it's based on low income. They will help you pay the premiums, deductibles, and copays for Medicare Part D drug card. So you can call Social Security and find out if you qualify. When you first sign up for Medicare, they usually send you information in the mail about this program. So this is what it looks like for 2025. And of course, I was looking to see if I could compare this to the current plan, but NABIB did not do an infographic for 2025, but I found one for 2023. And I thought this would be interesting just to do a quick comparison because, oh, by the way, 2023 and 24 are very similar. So 2023, you had the deductible and the initial coverage, right? So you had a deductible and or copays or coinsurance, and then you hit what we call the coverage gap, which was formerly known as the donut hole, right? They don't want you to say that anymore. And you got there in 2023 by having $4,660 retail drug costs. Once you got there, you paid 25% of the cost of the drug, and the drug card paid 75% until you hit another number, 7,400 out of pocket. Okay, true out of pocket really didn't apply this year. Once you hit that, you went over and above that, you're going to pay a small copay or 5% of the cost, whichever is better. So you really never got to 100% coverage back in 2023 and years prior. However, they did change this for 2024, and this number 7,400 became 8,000. And once you hit 8,000, you did not have any more copays. It was 100% coverage. But I want to point something out here because I find it very interesting. They said we're doing away with the donut hole and the coverage gap. You're not going to have that anymore. But the coverage gap currently, when you get there, you pay 25% of the cost of the drug. Oh, by the way, when you get to the initial coverage gap, you pay 25% of the cost of the drug. So this is identical to the donut hole. They're just calling it the initial coverage. I'm just amused by that. Let's talk premiums. What is this going to cost us? Because the average cost has gone up as well as the deductibles. I did a little research on the internet to see what the average cost has been over the years. Let's see, Kaiser Family Foundation, they gave some numbers. When this Medicare drug card started in 2006, it was $23 on average. That was the average price. By 2015, it was $30. So it went up 13 bucks, which percentage wise is 56% over 9 years. If we look at 2015 to 2024, which, oh, by the way, is another 9 years, exactly $13 on average. When I Googled it the first time, there it is, $43. This is AI, AI is pulling numbers from different places and saying, this is what we found. I did it a second time. Oh, by the way, average national cost of Medicare PDP. The only thing that's different is I didn't capitalize. And the second time around, I got $55. But I don't know which number to use. If you use 43, that's another $13 that the premium went up from 2015 until 2024. And that's another 13, that's another 43%. So since we started, we're nearly double as far as the premium goes. So what is it going to be for next year? And, part of the law said that they cannot, the Inflation Reduction Act, and I pulled up CMS's government. Oh, here it is. Announces the Part D bid information and premium stabilization. Okay, what are they talking about here? Well, we know that as part of the Inflation Reduction Act, they're trying to lower the out-of-pocket costs for Medicare recipients, right? Beneficiaries are only going to pay $2,000, and they supposedly capped, and they implemented this starting in 2025. The maximum premium increase is 6%, but there were some drug cards that went up higher than 6%. And this announcement, I dug through it, couldn't find anything, but going down a rabbit hole, this gentleman is on LinkedIn. His name is Calvin Bagley. He's part of the Medicare space. He's president and CEO of the Medicare store. And he was talking about CMS releasing their numbers, right? And so here's what he reported just 2 days ago. He said that for 2025 Medicare Part D base premium, okay, the base premium is increasing a modest 6%. However, the bid amounts can increase 280%, almost 3 times. What does this mean? The bid amount is for Medicare Part D from 24 to 25 is going from $64.28 to $179. So in all my research, I found a chart that said, here's the base premium. Okay, so currently it's at $34, right? But the bid amount is $64. Is that the cost or the highest? It's not the highest premium because in the state of Illinois, we have $100 a month. I believe what this amount is what it costs to administer these this and what they're doing is they're subsidizing some of that premium so that the beneficiary is only paying $34 on average. Now this is the national average and it's going up to $36.78. I think this is the number they use when you pay a late penalty for Part D. And so they have to calculate based on a percentage. But like I said, in the state of Illinois, we're from $0 to $100 a month. This cost here is really what the true cost is. And this was our fear, is because when you go from 8,000 out of pocket max to 2,000 out of pocket max, that's a huge cost. Who's going to pay for that? Well, according to this gentleman in this article and this video, he's saying that the government's going to pay and we're not going to pass along this cost to beneficiaries. So I find that interesting. And my question is this going to be for each and every year? Is the government going to subsidize this? And one of the comments this gentleman said was, why are they doing this? Because and I don't know if this is true, when they originally passed the Inflation Reduction Act, it was that a thought that the government is not going to fund this, right? It's going to be funded by people on beneficiaries of Medicare, the insurance companies and the drug manufacturers. But one, it's an election year. Two, I don't think it would go over well if they increase the cost to the Medicare beneficiary, 280%. I don't see that happening. The question is, if this is the true cost, what's the premium going to be? And people are now saying it's about 6% on average, because that's the national average. That's the base premium. And my understanding is that's what the beneficiary is going to be responsible for. So we could see 6 to 10%. They're saying that the government is buffering the true cost of this 8,000 max out of pocket down to 2,000 out of pocket. It will not be bore by the responsibility will not be on the shoulders of Medicare beneficiaries, which is a good thing. My question is, how long can they afford to do this? Because I did a little math and was looking at if this is the true cost and the government's funding this, the difference between $64 for the bid amount and $179 is $115 a month per beneficiary, is what they're saying. And if you multiply by 12 and multiply by the number of people on Medicare, which is, oh, by the way, 67 million people, you come up with a number of $92 billion for the cost of this 8,000 to 2,000. $92.46 billion. Now, currently, and I Googled this, 2023, the cost of Medicare entirely, the government it's costing them $832 billion. So as a percentage, this one little change in the drug card is increasing the cost of Medicare, not counting doctor's visits or anything, 11%. So how long can the government continue to fund this? Are they just putting a Band-Aid on it this year? And are they going to incrementally pass along this cost over the next couple of years? The good news is that they're not passing it on to beneficiaries. We're expecting 6% rate increase-ish. Don't know until October 1st, but we kind of dodged a bullet, because everybody is saying the cost of administering this drug from, who's going to pay that $6,000 is going to be very pricey. And so the drug card is changing next year. Donut hole is going away, but they just gave it a new name. Once you hit the deductible, you pay 25% of the cost. The drug company pays, the insurance company that provides the Part D drug card pays 75% until you hit 2,000 out of pocket max. Hopefully the premiums won't be that high. We're looking at 6%. We think, we don't know for sure. The government is absorbing the rest. They're funding the rest of this massive change. So we hope you found this video helpful. Until next time, this is Kathy Bukowski, the owner of CB Health Insurance.